How old are you?
34.
Oh, okay. You're getting up there too, bro.
Yeah. I'm the oldest guy on my team. It's never happened to me in my life. I've been playing sports for years.
That's jokes.
Yeah,
That's
so
jokes.
oldest guy on my team. That was nice.
It's good to see that we're still pushing hard. We're still playing. And that's kind of why we have you here at the podcast today, actually, to talk about what you're doing and how you're helping others in your business, your community, myself included. So welcome back to the podcast. I've got good friend Farhan Ratansi on the show today. He's a chiropractor. He is a individual who I've known for a few years now. And I mean, if you've seen him, great energy, great vibes. I think you should have your own podcast too, by the way. Yeah, in all seriousness though, you should have something with your content and stuff. I think you bring some great value to your audience.
I appreciate that. Yeah. Start here. Start here,
man.
Steps. Yeah.
This is it. So number one. But give us a quick intro about what you do and how you got into your profession. Really kind of what was your passion behind the whole chiropractic profession?
Yeah, of course. So I started in kinesiology through university, kind of the study of human movement. So I always had a bit of a kind of lean towards that in terms of, wanting to understand it better and know how to use it. And I didn't really know much about chiropractic until I got my own injury. I got an injury at soccer where I was hit from behind, had some serious whiplash. So someone from our community who's now, very close friend of mine and a good patient of mine as well, sent me to who is now my mentor for chiropractic care.
Nice.
So at that time, my fiance and I, now my wife, but we started going to see him and just opened my eyes to what chiropractic could be. I treat sports injuries, as long-standing injuries, and then there's the classic chiropractic injuries. But the thing that kind of led me to want to be a chiropractor was to kind of find a way to help people and my passion for sport. I've been playing sport in our community for a very long time, albeit not well, but always playing.
Oh, you're great, bro.
I love to kind of see that continue and get people to always, not to steal from Biggie, but, play forever. Hamoudi, play forever, right? They have a great foundation, but get people doing what they love for as long as they want to do it. And if I can get people doing the things that they love, they feel better. Their brains are healthier. So many things come with being able to do the things that you love as opposed to just doing the things that you need to do. And I think, when our bodies are limiting that, it sucks. So being able to kind of break that barrier and get people back to doing what they want to do, that's where the passion stems from.
It talks about my injury when I came to you in January, right? We were talking about how I had a shoulder injury for the past, I think 15 years. And I didn't realize how important physio was until I came to you. And within 2.5 months, it's at least 70% better. I sent you a picture of me at the gym the other day.
It was great.
Where I was working out for the first time after honestly years. And I could actually put weights above my head. And there's still some pain, but it's not as bad as it was, from years past. So I thank you for that. I mean, I appreciate that. Man. And it's allowed me to play better, keep healthy. But I guess the question is that why do you think people don't resort to physio soon enough? I know why I didn't. Maybe it was procrastination. But what are the reasons? And if you can elaborate on that and what people should do to get a treatment done.
I think a lot of the time it's people have a hard time with putting in the work to see the results over a period of time. Like you said, it took 2.5 months to get you there, and you're still not 100% of the way there. And one of the ways, especially from a chiropractic standpoint, we're working on the spine, we're working on the extremity, in your case, the shoulder, and certain injuries may have happened last week, and those are a little bit easier to start, improving and getting better. But a lot of people have long-standing injuries, chronic pain patterns, where the best way to start getting them to improve and feel better is to put in the work. That even through the treatments with you through 2.5 months, I had asked you to work on specific things, and we would modify those things as we went. As you improved, as things felt a little bit, didn't feel great, or certain things felt better, we would lean into that. But no one appointment can tease all of that out. So it's really important to be able to go through these appointments and kind of understand what's needed, what needs to be worked on, and then putting in the work at home. A pattern that I always talk to you about is conscious intention, right? You really have to consciously put the effort to rehab yourself back from an injury, especially when the end goal isn't just, combing your hair in the case of a shoulder. We're talking about being able to play basketball bad timing on my part. You cooked me the last time we played, but when your shoulder's feeling better, that's a product of the work that you put into it, right? And consciously focusing on certain pathways and patterns that are going to help improve your shoulder mechanics overall. And that way you can get to playing not just, playing carom, actually playing physical sports like basketball, working out, doing the things that, you feel like you need to do in order to have a kind of more complete picture of your day-to-day life, right? You're not just working or dealing with kids. You're doing the things that you love as well. Yeah. Not that you don't love working your kids.
Of course. Yeah. No, that's great, man. And I think, for me, it was really just also procrastination as well, a lot. But like I said, 15 years of injury, and I came to you, and within 2.5 months, I've seen the progress. And I can't wait to see what the rest of the year unfolds as I keep coming to you and I keep getting help and treatment. But for our audience, what are some of the injuries that the everyday man or woman face over the years when it comes to their back, their posture, and why is it that, humans in general do have these injuries, and what can they do about it now?
Yeah, I think it's a great question. There's a lot of, we see so many different types of injuries. Me, myself, because I play a lot of sports, I have a lot of guys that come to me with sports injuries, and those are fun. We get to work on those. We get to see people get better and see those improvements. But some of the things that I see the most of are exactly what you said, are postural problems. Whether that's related to, one side of the low back hurting, shoulders hurting, neck and headaches, back pain, jaw pain, like you once came in with, right? A lot of those types of things they're not a single event that cause it. It's a bit of a pattern or even myself included, we all fall victims to poor posture. So when people are dealing with these things, sit up a little bit straight.
There you go. That's a good reminder.
It's poor posture, right? And, people go about their day-to-day lives and they fall into the same habits, and no fault on them. They don't think about these things. So, when I'm around and I'm like, praying namaz at mosque, I see people in bad posture are like, okay, just focus on your namaz right now. But you see it all the time. Right. So being able to kind of identify where those faults are and being able to treat those things back to improve posture. It's not a one-day fix, right? It always takes a bit of conscious intention. It takes work on my part, and it's a bit of a team effort as we go to see these things start to improve. But I would say that the most common problems, and if I just give 3 off the top, is neck strains. Yeah. Right. The classic, I can't turn my head and check my blind spot. Right. The second one is what we call like an SI joint sprain. And a lot of people will say like, oh, it's my sciatica is flared up. And again, it's on the backside of your body. You have pain. Sometimes it radiates down, but usually it comes from how your spine is sitting on top of your pelvis. Even, a really common problem that just last week I had a patient that still identify that he's sitting on his wallet, right? Oh, yeah. So sitting on your wallet, I think we talked about this early on, right? Sitting on your wallet is over time can start to shift the level of your pelvis and kind of jam one side up. And these are injuries that, you just wake up one morning, all of a sudden it's like, oh, I can't move. And it's like, well, why did that happen? And in your mind, you're running through all of these things. And when we start to look at the patterns that lead up to it, they start to highlight those injuries. And then the third most common, which, really hits home with you, is jaw pain. And not a lot of chiropractors treat that. But we have day-to-day stress, we have anxiety, and our main thing is kind of to clench the jaw. A lot of people do this, whether they grind their teeth at night or through the day when they're feeling anxious, they clench their jaw. So seeing that one and being able to treat that's something that I kind of put a little bit more focus into before I graduated, and even after graduation, to be able to help people with that condition is an interesting one. And we see some pretty cool results with that. When we start getting that to open up.
I had no idea you treated that until I saw your post on Instagram, I think 6 months ago. And I messaged you. I'm like, I got to come. And then I think 4 months went by, and so I saw the ad again. I was like, let me go back. And then that's where 2026 for me was like, I'm gonna get my body right.
It's good.
That was my goal, and alhamdulillah, so far it's been good. But the jaw treatment that you had provided and the exercises and the rehab, I mean, it was incredible, man. Like, I sit here today and I can tell you honestly that my pain has been 99% gone.
Amazing.
And when I came to see you first, I was in so much pain where I was getting headaches on the right side of my temple or my head. And I think it was because of, clenching my teeth or grinding my teeth. and I didn't know there was a cure. So thank you for that. And I think for anyone who has that pain, I mean, definitely go to Dr. Farhan. He is really a gem, and I think he can really fix that situation. He did for me, and it's paid off completely because now I can work properly. I can focus on my kids, focus on my work. There was days where I couldn't work. I was just in bed in pain. So alhamdulillah, thank you for that. And,
No, of course.
Aside from that, like, what other treatments do you do as well? If you have jaw pain, chiropractor, is there anything else outside of that you do?
Like as a chiropractor, I treat all kinds of musculoskeletal conditions. So whether that's like we talked about sports injuries, your everyday aches and pains, a lot of migraines and headaches, and that stems a lot from kind of the same pathway that led to the TMJ, not necessarily exactly the same, but you remember us working on your upper neck, and there's a lot of research and evidence that shows, being able to improve neck mobility and alleviating the tightness in the muscles of the neck can help with migraines. And that's a big one that a lot of people don't realize that we can treat. So we see a lot of that. And I also use, a combination of manual therapy, which, disclaimer, it does suck, especially when we're working on the TMJ. There's days you won't like me and you might swear at me. So we use manual therapy. We use, training and rehab patterns, but we also use laser therapy. And laser therapy has been one of the cool things that I've implemented into my own practice. I was using it at previous practices before, and I've come across like a really cool one. It's used by the Toronto Raptors. I think they're still on contract with the LA Rams, the BioFlex lasers, and they work incredibly. So especially with acute injuries and sports injuries of that nature, chronic pain. So using a combination of manual therapy, rehab patterns, education, laser, kind of all of those types of tools to kind of develop treatment plans, and there's no one plan fits all. Everyone's a little bit different. Your shoulder will be different than someone else's shoulder. Your goals may be a little bit different than somebody else. So we always try to tailor those types of treatment plans to the person that's sitting in front or sitting on the table. And that's how we start to really see people improve. And it has to be a combination of, and involves teamwork, right? Both you and I together to help rehab that pain. It's quite a few different things.
How does it feel when your clients come back to you and say, Farhan, man, like this was amazing and you've really fixed my injuries? Kind of for me, like when we sell a house, it's a satisfaction, right? When someone comes back and says, we found our dream house. But how does that translate into your industry for you?
Yeah, it's good. Like I feel like when someone's like, oh, that treatment you did was amazing, like that feels good. But like it's even better when someone follows through on the plan of like the things that they should be doing. Because then it's not just like, oh, like I came to you, I got better. Like, okay, that's great. But when you can help yourself also stay better, that to me is the kind of the thing that makes me the happiest. Like coming in on 1 week and coming back the next week saying I felt amazing, that's great. But like when you come back 2 months later, said like I've been doing the things that you've been telling me, or working on those certain pathways that were asleep, for the lack of a better word. Now I'm not, I can go to the gym, or when people can do the things that they want to do and have more function, not just like be pain-free. Being pain-free is awesome, but being able to be functional and do the things that you weren't able to do before, that to me is like the ultimate like satisfaction. Like patients are truly getting better, not just feeling better.
And I think as we get older and we have responsibilities, the common misconception is that father time is going to hit us and that we're going to slow down. But one thing I learned from you is that sometimes, there is that element of father time, but a big portion of that is also because us not taking care of our bodies. And when we reactivate those muscles and our injuries, we can play for a longer period of time and be just as effective as we were when we were younger, because now we're actually doing the things that we're supposed to be doing. So that's something that I love. I always had this idea that,
once
I'm 40, I'm going to be like slowing down. But you and I are still running with the young guys at JVA.
Like, that's awesome.
So it feels nice. And hopefully we can, next 10, 20 years, you never know. But
keep playing. We might have to make our own league in 20 years.
We may have to, like in over 40 or 50 one time. But I remember you told me that the idea is to be long, play with longevity. As long as, because we love playing sports.
Of course.
I can't imagine myself not playing. I'm going to be so depressed. So I got to keep playing as long as I can. I'm going to keep coming to you for as long as I can. So
let's do it.
But let's kind of shift the conversation to, I guess, kids now or teenagers, because that doesn't get taught a lot about, because we talk about rehab for the adults. But do you treat, the younger generation, and what are some tips that you can provide to them so that they don't have these same injuries as they grow older?
Yeah, I think that's a great question. So there's two types of, injuries that we talk about. And the same thing with adults as kids is a sports injury side of things. And, us being now second generation and third generation, we have a little bit more resources to put our kids in so many sports. Yeah. So one thing I do see a lot of is like parents putting their kids in a lot of sports, like 4 or 5 times a week. And there's nothing wrong with that, but just to kind of keep an eye out on, areas that may be getting overworked, or, a lot of the time we see feet in kids, and, there's orthotics, and there's so many different things that people can do to help improve foot function. Yeah. But one of the main things is actually strengthening the foot, even for kids, because they fall into bad habits as well. And when you're doing the same thing repetitively, playing a sport 5 days a week, which is amazing because that helps get our next generation to those competitive levels. It's also important to keep in mind, making sure the base is strong. So when we talk about the feet, making sure that the foot mechanics are healthy, and that's going to help to lead, to healthy knee mechanics, hip mechanics, the same way that we would treat in an adult. It's even more important in a kid to make sure that their base is set. And when the base is set, that allows them to grow and flourish in whatever sport that they want to go to. But the second thing that I see a lot in kids, and this can be in kids of all ages, right? As young as my kids and like 3 and 4 years old, as old as, 15, 16, is the postural side of things. Now, 3 and 4, they're running around. They're not necessarily sitting at a desk like the older teenagers are. So the posture side of things is a little bit different. But when, people are sitting in school all day long, their posture starts to really take a hit. You see kids with, really forward head postures. And when we see it at young ages, we don't think much of it. They're kids, they're studying all the time, but those habits then become our bad habits that we've kind of kept since that time. So being able to kind of address those and understand what's needed to prevent someone from falling into really poor posture. And a lot of that comes back to that same point of conscious intention, right? And to help teach a kid is like, okay, look, I want you to try to sit like this for 5 minutes a day, but break it up 10 times. So the 30-second bouts of just sitting in an improved posture position. When they can start to have those types of patterns and use that to their advantage, that helps to mitigate a lot of the posture related problems that I see in kind of teenagers to kids, where you start seeing headaches already, you start seeing upper back pain and neck pain, and you start to see that, dreaded hump that starts to show up on the top of the back. We have it, a lot of us you see around start to have it, and kids are starting to develop it a lot earlier. Now, whether that's related to, increased screen time, more laptops, heavier backpacks with laptops in them, there's no real one reason. There's a lot of factors that go into it. Something my niece taught me a while ago is, kids need to go touch grass, which is like get outside and play a little bit more. And I love that because, sometimes we get so much more protective. Then, when we were kids, we used to be able to just go out and play, and it was like, just get home before the lights go out. Now, of course, we know more, so we're a little bit more scared, and we want a little bit more closer eye on our kids, and that might mean they're not playing outside for as long. That's, I think, an important balance to make sure that they're not just always sitting in front of a screen or a desk, but also being able to enjoy life and be active and play. And then the last one that I think is the most interesting, it's a little bit, people can have different opinions on it, is, irritability in kids. Okay. Irritability in kids is something that, as a chiropractor who's doing a little bit more training and working with pediatric cases, it's an interesting thing that we can actually have an impact on. Yeah. So we've talked so much about the mechanics of chiropractic, but the most beautiful part of chiropractic is how it impacts the nervous system. When we're adjusting the spine, and I've explained this to you before, when we're adjusting on the neck, why are we adjusting on the neck for your shoulder? Yeah. Well, the nerves that control the shoulder, they start in the neck. And with kids, the same nerves that, are going through their body from their spine, when we're able to, what we call, optimize the function of those nerves, the body works a lot better. So sometimes stomach irritability, not just, behavioral irritability, but like kids have stomach issues. Working on the mid and low back, there's limited evidence, albeit there's not a great amount of it, but there's a lot more anecdotal evidence from chiropractors as well as patients that have shown pretty good results with being able to improve some of those things. Now, like I said, it is a controversial topic in chiropractic, and my mentor would talk a lot about this type of stuff. The chiropractic school, not as much, but different types of conditions, whether it be digestive, whether it be behavioral, whether it be sometimes just the need to just constantly shake your leg in class. And I was like that as a kid. I'd always shake my leg. My teacher would be like, stop that. Yeah. That comes from, sometimes the nervous system being overloaded. Yeah. And it's not it's not unheard of to have the nervous system overloaded, especially with all the different stimulants that we have in our day-to-day life. So being able to calm down the nervous system by providing an adjustment or providing a very, I haven't shown you how we adjust kids sometimes, but they're extremely gentle adjustments. Sometimes it's just pressure over the spine to help correct the nervous system. And when we take that pressure off of the nervous system, it can help improve some of that irritability. And we don't work alone. There's lots of, there's behavioral therapists for kids, there's dietitians and gastroenterologists and all these different types of fields that when we work together, we can see even better improvements. I think a lot of the time, because of the controversy, we're always kind of battling each other.
Yeah.
And in all honesty, these professions are targeted to help kids, and that should be the focus at the end of the day. So that's a cool one. I'm doing more training in that, and I find it to be one of the more interesting things that, we learned in school, but again, albeit limited. So be able to go in and dive into that, especially with me having young kids and so many of my peers and colleagues having young kids, it's a fun thing to get into.
Yeah. No, I love your passion. I mean, whenever I come for treatment, it's really like a seminar for me to learn. It's so
that
cool.
means I talk too much.
No, I love it, bro, guys. I love how everything is so connected, the body. And I didn't realize the connection from one part to the other and how it can impact so many different ways. So it's really, for me, it was an eye opener, man. I loved it. So thank you for that.
No, man, I'm glad that, like I said, when you put in the work, when you do the things that help address those patterns, you see the improvements.
Absolutely.
And patience is needed with this type of profession. It's not a one-stop shop. 100%. I know a lot of people are just fix it. I try, but it takes a few visits to be able to really start seeing long-term improvements.
Absolutely. Okay, so we'll end off with a couple of rapid fire questions.
Let's do it.
And I'm going to ask you short answers. What's the worst injury you have seen?
Probably a slip disc.
Okay.
And that means where the disc from the spine has kind of pushing out onto a nerve. And I'm talking about young guys, kind of mid-20s, mid-30s that I've seen that can't even move, can't get up from, and these aren't weak people. These are strong individuals who may have had a gym injury or something, a slip at work, and their disc has kind of popped out of their spine.
Ouch.
That to me is the hardest thing to see someone dealing with, because you're asking them to stand up straight or be able to move their leg, and they physically can't because of the amount of either pain or nerve dysfunction in that area. That would probably be the worst injury. Of course, there's freak accidents, fractures and breaks and stuff like that. That's sports related. And you can see those anywhere, but definitely slip disc.
Okay. What is the most common injury in football, in flag football that we play, that you've seen?
Most common injury in flag football. So you have the knees, the non-contact injuries with knees. See a lot of jam fingers, trying to grab a flag, people jamming their fingers. And a few instances of whiplash. It's a contact sport. You might get hit. I know I got one the other day. I got hit from behind. Man. Play sports forever, man. That's the thing. Do the rehab stuff. But also a little bit of whiplash, getting hit from behind, or just not seeing a defender come from behind you or whatever. But I think between jam fingers and knees were probably the leaders in flag football.
Okay. When you get injured, do you treat yourself?
Absolutely. I try. I use laser. I use a lot of the same patterns. One of the main things, I know you said quick answers, but we're going to talk about this. I stopped using ice. I stopped using ice for sports injuries.
Oh, yeah, okay.
And I know that people are like, what are you talking about? That's crazy. You should be using ice. And so the researcher, his name is Dr. Gabe Merkin. You guys can take a look at him. 1973 or 83, I think it was 1973, came out with what we know as RICE. RICE is rest, ice, compress, elevate, those four major factors. In 2015, Dr. Merkin came out and he actually said, I was wrong. It doesn't happen a lot in research, and the reason for that is that ice, while it helps things feel better, it slows blood flow, and we want to improve blood flow as well as improve movement in those areas. So let's say I'm playing basketball on a Saturday night, touch wood, and I sprain my ankle. One of the things that I want to avoid, if I can manage the pain, if I can put pressure and walk out of the gym the way most people do when they sprain their ankle, I would advise, not putting ice on that area, because we want to try to get it back to normal movement as soon as possible. So elevate it, yes, move it without putting weight on it, aka ankle rolls. I have people spell their name out with their toes all the time to really get a full range of motion. Compress it, can brace it if I need to, if I have to go to work and I'm on my feet all day. Those things all yes, but if we can avoid putting ice on it, ice kind of slows that initial healing process. We want the inflammation or the kind of stuff that's happening at the injury site to get back into circulation so that it goes to our brain, and then our brain can send the appropriate healing factors to the injury site. That is probably the biggest thing that I've changed about my own injury rehab is I stopped using ice. Of course, I use laser on acute sports injuries. I see a chiropractor myself if I have, I need my adjustments and I need to be tuned up and maintained. Shout out to Dr. Kosmachuk, who I go see all the time. But that's the ways that I kind of treat myself, making sure that we just keep areas moving if they get hurt. And then, of course, conscious intention to training the way that we want to heal. Right? If I want to heal my ankle, I'm not just going to work on my biceps and my back, right? Got to work on those specific areas and build them back up so that they're prepared to go play the sport the way that I was playing before.
Beautiful. Amazing. Where can people find you, and where is your clinics at the moment?
So I work at my own clinic, Prime Spine Chiropractic Care. It's at Major Mac and Woodbine, just off the 404 in Cathedral Town. So if you've ever seen that big cathedral, that's where the clinic is. I'm on Instagram working on a little bit more content as you kind of started this off with. So hopefully in the next week or two that will be coming out. So a bit more of me talking. If you're sick of me already, then you'll see me in a couple weeks again. And my clinic website, primespinechiro.ca. You can always find more information on there, and I'll find a direct link to be able to send me a message. If you have any questions ever about this type of stuff, I'm a nerd for it. I love it, and I'm an open book. So I'm always willing to entertain and ask if you have any questions to be able to understand what's going on and at least give you a better understanding for what your next steps could be. So for anyone that's dealing with an injury, by all means, come on through.
Thank you so much. No, I really appreciate that.
No, man, I appreciate you, man.
Thank you for having coming on. Hopefully I'll have you on again in the future. And we'll have this information in the captions as well. Any questions, reach out to myself or reach out to Farhan as well. And thank you, I really appreciate it, bro.
No, man, I really, really appreciate you having me on. And
thank you.
Teammates in so many different ways for a long time, man. I'd love to continue it.
Thank you guys. See you next episode. As you guys know, I started my podcast 2.5 years ago, and we are almost at 70 episodes now. If you get a chance and if you like this information and content, please subscribe to the channel. Please share and like all the videos you've seen so far. And if you are a home buyer and a home seller looking to get more information and you've liked what you've seen in these podcasts and you want to set up a meeting to discuss your future plans, give me a shout, reach out to me at 647-995-7292 or DM me on Instagram or Facebook, and let's get your next move started. Thank you very much.